Greetings. This annual report of the Wisconsin Dental Association's programs and services is merely a snapshot of our members' dues dollars at work for the first 10 months of the year. We hope you enjoy this look at the WDA in action.
Teamwork. The combined individual talents and efforts of Wisconsin Dental Association member dentists, staff, and strategic partners during 2010 allowed the association to forge a better profession and better care for Wisconsin residents. The concept of teamwork was most visible at the second WDA and WDA Foundation Mission of Mercy this past June in Sheboygan.
Mission of Mercy 2010 was a great success. It took about 1,000 volunteers to do it, from people parking cars to security to food service. But I tell people, the 1,000 people, do like one little piece of the puzzle to make a beautiful picture. It didn't matter which piece of the puzzle you were. Each person had a distinct job, and it made the Mission of Mercy a great success. We had over 2,000 patient visits. Some patients got to go through the line twice to get more than one thing done, and almost $900,000 was donated. So we did a great success in those 2 days.
Other WDA Foundation successes included awarding many grants and scholarships, joining Community Health Charities of Wisconsin, and marking 12 years of its donated dental services program by exceeding $6 million in care. At year's end, Dr. Paul Oberbreckling retires after 10 years serving as Foundation President. The WDA, Wisconsin Division of Public Health, and American Dental Association continued teaming up to promote water fluoridation. The results? Wisconsin has surpassed the Healthy People 2010 goal of 69% of the population on community water systems having access to optimally fluoridated water. Delta Dental of Wisconsin and the WDA co-sponsored Your Patients, Better SmokeFree. Held at 5 locations, this CE course came on the heels of the Dentistry Examining Board's ruling that tobacco cessation counseling and prescriptions are within the scope of practice for dentists. Some 200 dentists participated, with proceeds benefiting the WDA Foundation. Awaiting confirmation to the DEB is WDA member Dr. Lindsay Nell.
Dentists need to be willing to participate in the regulatory and legislative process that, quite frankly, dictates how we practice dentistry in this state. And I'm not just talking about serving on the DEB, joining the WDA's legislative committee, or participating in WIDPAC, or simply just coming to Madison one day out of the year for legislative day are all ways that dentists can contribute. If we're not willing to do that, who does that leave to influence the process? Think about that for a moment. So I welcome the opportunity and the challenges that come along with serving on the DEB, and it really is my privilege to serve the profession in that capacity.
The Wisconsin Supply and Demand for Dental Services 2010-2020 report launched in January. It revealed, our state has enough dentists for the next 10 years. Wisconsin dentists employ more dental staff and use them more efficiently than their peers nationally, and dental workforce numbers are not a major barrier to care for medical assistants and underserved patients. Another team-based workforce effort involved facilitating contracts between federally qualified health centers and private practice dentists. A new practice placement coordinator at Marquette University School of Dentistry is also helping recruit dentists to underserved areas. While Wisconsin dentists continue to provide care to a growing medical assistance population, the WDA teamed up with the ADA to address barriers to care through public policy, with the support of a state public affairs grant.
The ADA State Public Affairs Grant has allowed us to bring in some additional resources to support the work of Mara Brooks in our Madison office and Carol Weber here in our West Dallas office. We've been able to hire 2 high-quality consultants, Forbes McIntosh in Madison, Evan Zeppos and Associates here in Milwaukee. This will also allow us to produce a comprehensive communications plan that we can share with legislators and policymakers in Madison that'll show them how we, as the oral health experts, can help them solve the barriers to dental care that's so greatly needed.
Dental access was one of many issues contributing to a steady increase in media coverage in 2010. Because all media is local, the WDA relied on a team of dentists in different markets to serve as spokespersons. Thanks to their efforts, the majority of news coverage presented the WDA and its positions positively. Media relations and paid media, as part of comprehensive public awareness campaigns, have propelled statewide awareness of the WDA to an all-time high of 79%. This year's public awareness campaign emphasized patient responsibility in maintaining oral health with two 15-second back-to-basics television spots, including choices. When you think about all the things we choose to spend our money on, it becomes clear that sometimes life is all about the choices we make. Make a healthy, affordable choice. See your dentist. A message from the Wisconsin Dental Association. The WDA Dental Home Infant Oral Health message continued to spread, with the Georgia, Indiana, and Minnesota Dental Associations licensing these continuing education materials. Local membership and involvement is critical to long-term WDA vitality. WDA components were supported in 2010 through individual pages on WDA.org, a Component Connection newsletter, and the annual Component Officers Breakfast. Nothing is more local than politics, where the WDA Political Action Team built and strengthened legislative relationships. Says new WIDPAC Chair Dr. Dave Clemens, "My first loyalty is to the Tooth Party. When we see interferences with our business practices that are not good for our patients or the delivery of dental care, I believe it is vital to be present at the table and help shape our own future. This can be done by becoming politically involved." A team is always stronger together than apart, and nowhere is that more relevant than within the dental profession's tripartite organization.
The ADA state and local dental societies work to provide tools and resources to help our member dentists practice more efficiently and treat their patients more effectively. This unique tripartite system gives member dentists access to the strength of more than 157,000 of their colleagues, while also providing specialized and personalized programs and services at the state and local levels. Organized dentistry helps to ensure that our profession remains viable.
With membership at almost 84% of all licensed dentists in Wisconsin, the WDA is one of the strongest state dental associations. While an aging demographic means more members in reduced and non-dues categories, the Mentor program continues to help bring new dentists into the association. Attendance at the 2010 Jewel of the Great Lakes was disappointing despite high-quality, nationally known CE speakers and more than 100 exhibit hall vendors. In response to dentist and exhibitor comments, the 2011 annual session will offer 2 Saturday morning courses, expanded exhibit hall hours, and a return of the welcome reception. Online registration opens in January. Plan now to learn and network with dental colleagues from across the Midwest at Monona Terrace in Madison on May 12th, 13th, and 14th. Members are kept informed of the Jewel and other WDA news through a variety of print and electronic communication tools. In 2010, the WDA Journal was again recognized for excellence with awards from the International College of Dentists and local chapter of the Public Relations Society of America. The Executive Director's Update also received a PRSA award. Social media is receiving more emphasis as the WDA uses these increasingly popular tools to communicate with members and the public. In January 2010, the association's for-profit subsidiaries became WDA Insurance and Services Corporation.
Well, last fall, our for-profit board really took a look at our organization and recognized that we had 4 corporations, and that led to a lot of expenses. So as a result of that, we consolidated those into one, and that one corporation is WDA Insurance and Services Corporation. And because of that consolidation, we've saved a fair amount of money in audit fees, taxes, and internal expenses. And between WDA insurance programs and WDA professional services, we now actually have 34 endorsed programs. Now, since January, we've developed 3 new programs. We have a personal lines, auto, and homeowners program, Office Site, our website development firm, and Scientific Metals, which is our new metal refining company. And currently, we're working on a number of new potential endorsements: AEDs and emergency supplies, amalgam separators, medical waste disposal services, a human resources program, and we've really got a lot going for the benefit of our members.
The WDA strategic plan was reviewed in spring to provide a roadmap for 2011 and beyond. An all-member survey will soon ask dentists what they want and expect in terms of programs and services. In the legislative arena, WDA high priorities will include dental benefits regulation that combines a non-covered services proposal with last session's assignment of benefits direct pay legislation. An omnibus workforce bill will aim to reduce barriers to care through greater delegation of duties to trained allied dental personnel, an expanded definition of dentistry, and collaborative dental hygiene practice. The WDA also supports a building expansion for Marquette University School of Dentistry. WDA Legislative Day 2011 will be held March 30th at Monona Terrace in Madison. Your participation is more important than ever with a new governor and many new state legislators taking office in January. New hygiene and group dental practice membership categories will also be explored in the coming year. A new WDA public awareness campaign, Baby Teeth Matter, will mark the next phase of the Dental Home Initiative with paid media spots, an expanded online presence, targeted media outreach, and patient education materials. Advocate, educate, empower, serve. These Wisconsin Dental Association goals continue to require the teamwork of all our members and staff.
Please invite your dental colleagues to visit the WDA website or YouTube channel and view this summary of our accomplishments. And then ask them to join Organized Dentistry in 2011. Every member is a vital part of the WDA team. I am proud to be a member of the Wisconsin Dental Association, and I know you are too. Thank you.